things that can change some permanent thing to something that's not stable.
You're right. No, very good point, because the alignment that was corrected through this neuromuscular dentistry treatment can be undone, for instance, if they were in an accident, God forbid, or something along those lines that threw the alignment off.
Exactly.
We're now going to meet a patient and her husband. Welcome, Kim.
Thank you.
And James, who I understand Kim is your wife?
Yes, she is.
Now, the migraine sufferer out of the two of you is you, Kim, correct?
Yes, it is.
Now, how long were you experiencing migraines, and what type of level of pain and so on were you experiencing as a result?
Well, I've been experiencing migraines for, I would say, at least 20 years. But in the past 10 years, they've been horrible. And over the past 2 years, they've gotten just crazy. So 1 out of 10, it would be 10.
Yeah, migraines, I'm very familiar with those, and people that we all know. There's millions of us that suffer from migraines, and it can get to the point it just totally wipes you out.
Exactly.
You can't sleep, you can't function, so on and so forth. And I wanted to ask you, what remedies did you try, Kim, to correct the migraines in the past, prior to coming to Drs. Yazdani and Mortazie?
Well, every over-the-counter medication I could try, Excedrin, Advil, migraine, everything.
Basically for pain relief, and none of it was able to help you.
None of it. It got to the point where I was taking so much Excedrin that it just stopped working altogether.
Well, that's certainly interesting, because again, we can relate to that. We know how bad and how acute this problem can be. Now, on that note, I wanted to ask you, Kim, why did you come to Dr. Yazdani and Dr. Mortazie, and also, what did you have done?
Well, I was seeing a neurologist for nearly a year, and after being on so many medications, prescribed medications, it just took a lot out of me, and I decided that I would try the neuromuscular therapy.
And that's what you came here for?
Right.
And then how long did that process take you?
Oh, it didn't take long. Once I started it, it didn't take long at all. I was having at least 4 migraines a week, and since I've had this therapy done and had the orthotic put into my mouth, I've had about 4 migraines, and it's been months.
Oh my God, that's a huge difference.
Huge.
Talk about pain relief being taken out completely.
Absolutely.
And minimized at the worst.
Absolutely.
Well, you certainly seem and look a lot better. In your voice, you seem very happy with the results. Certainly the migraines have been reduced dramatically, and that means you're a lot happier and enjoying life a lot more, right?
That's right.
Since you did the neuromuscular dentistry approach.
Right. It has made a huge difference in my life. I mean, the quality of my life is just absolutely here now.
Well, that's what it ultimately does come down to, right?
Right.
And James, as the husband, I'm sure you're very happy to know that your wife feels a lot better, which in turn makes you feel a lot better, I'm sure.
I'm very happy with the results. Before, it kind of hurt me because I was helpless. I could not do anything for her. But now, with the help of the doctors, we're very happy.
Well, I'm very happy to hear that. And on that note, I'd like to thank you, Kim and James, for coming down and sharing some of your thoughts with us.
Glad to do it.
We're now back with Dr. Yazdani and Dr. Mortazie. I must say, doctors, both Kim and certainly her husband, James, seem very pleased with the results.
Oh, they are.
They are.
Kim has had very significant improvement from where she got started and where she is now. And she keeps telling me that her child tells her that I have my mommy back. And that just brings tears to your eyes when you hear that from patients.
Of course, and in her particular case, as she just mentioned a few moments ago, 10 years is a long, long time, too long, to suffer from migraine headaches.
And have no answers.
That's right. And her husband just said, he said he felt helpless.
Exactly.
And now, look how both of them are, ecstatic.
And this is such a typical story. We hear this from so many patients as they go through the process, because it not only changes their life, it changes people's who are around them, changes their life as well.
That's right. Because what affects one affects everyone
the whole
around
family
that
and everybody who's around them.
That's right.
For positive. And that's just amazing. That's something that it makes us tremendously happy for what we do.
Yes, indeed. You're helping a lot of people through this treatment. I wanted to ask you, Dr. Yazdani, what makes your organization, Revive, so unique in this area?
The reason we named our practice Revive is because the type of dentistry that we do, we have found in many, many instances that patients come and tell us that they feel rejuvenated, revitalized, they feel like they're a new person. So we did change our name to Revive. And when you come to our office, you notice that it's a very comfortable surrounding. It's very spa-like, as we hear.
Yes, I feel like I came to a day spa when I came here today to tape the interview.
Exactly. Our intention was to make it to be very relaxing, comfortable, non-threatening to the patients, and completely different from an average dental office.
Things certainly have changed when one thinks of going to the dentist and then you come here.
Exactly.
Exactly.
We have designed our rooms so that even our dental chairs do not look like a typical dental chair. We have a big screen TV where the patient gets to see their own photos, x-rays, and we can discuss that with the patient. We can go over details with them. Each one of our room has a consultation area, so if there need to be any discussion with the patient about their treatment, they would be in complete privacy. Or if they need to bring a family member with them, there's always room in the room so that they can sit with the patient. Each room is also wired through computers, digital x-rays, and each patient has control of what music they like to hear during the treatment as well.
They can even hear music now while they're getting their work
They
done.
also can get a tour of their mouth on the first visit when they come in with our cameras, so they can see exactly what's going on in their mouth as well. They see what we see, and
Very
that's very
interesting.
powerful, yeah.
Now, we've only got a few moments left, and I have to ask you both, before I let you go today, if there's any final thoughts that you would like to share with our viewers.
Neuromuscular dentistry has been just amazing, how it's changed a lot of people's lives, and how it can help people get rid of pain that they haven't been able to get rid of for years and years through all different types of treatments. So just the fact that it helps people get rid of pain, I think, to me is amazing, and it changes everybody's life to me.
And without any surgery.
Without no
Without no
surgery,
Not at all.
no
No
drugs.
surgery, no drugs.
They can have a pain-free life. It's out there, and there's hope there.
And the Band-Aids are gone because no pain relievers needed when the migraines are eliminated.
Exactly.
And on that note, I'd like to thank you, Dr. Mortazie, and you as well, Dr. Yazdani, for joining us and both being guests today on A New Me.
Thank you very much for having us.
Thank you, Rocco. It's great to be here.
Oh, it was our pleasure, and I'd love to have you both on again. We can talk about another interesting topic within dentistry, which would be a surprise for our viewers.
Thank you.
Exactly. We
Thank
would love
you.
that.